Good morning, I'm Dr. Owens, chiropractic of Bellevue. We're here at my office. Hope you're having a great day as well. I wanted to show you a quick exercise today to do at your desk to help neck pain. And before we show you the exercise, I want to make sure that you understand, don't push into pain on this. Just move to the normal range of motion. Don't force anything. The motion is meant to be a nice, easy exercise. The exercise is called Yes, No, Maybe, and it's the motions that the neck are designed to do with the way the bones are shaped. The neck is designed to move back and forward, left and right, and side to side. Those are the three motions the neck is built for. And so what we want to do, we want to reinforce those motions so that they happen easier. As the joints move easier, it brings fluid and nutrition into the joints, helping it to be healthy. Movement causes that to happen. Here's the yes, and we just want to do it 10 to 15 times. Nothing really complex about this motion. Here's the no. Right and left, 15 times. As you do it, you'll notice that your neck gets looser. If you can only go to here before it starts to hurt, only go to there. That may be your motion. That's okay. And the maybe, side to side, 15 times. As you work these, work them 1 to 2 times a day, or if your neck feels uncomfortable, it'll help you feel a lot better. A couple of things that I want to caution you to avoid doing, and that is the rolling of the neck. That is commonly taught in martial arts classes and things like this. Very bad for the neck, especially in this back quadrant here where you're going back. Don't be doing that. It compresses the bones and the nerves, and it'll actually cause things to get worse. The second thing I want to caution you against, when you go to side, don't arch away. The tendency is to try and get that. You want to try and get the elbow to the shoulder. Well, that's not the goal. The goal is not to get the elbow to the shoulder. It's just to maximize your motion. So keep the head nice and straight. Do that 15 times each direction. The yes, the no, the maybe, and you'll have a healthier neck for life. A great little technique I learned and that I use myself to keep the shoulders pain-free, keep them mobile, and help you before your workouts, after the workouts. And all you need is a little stretchy band. And you can use any kind of stretchy band that you like. The exercise is called stretchy band dislocates. And what we're doing is we are going to work the shoulder through a range of motion where it's tight. Because we seldom move the shoulder back. We're always forward, doing computer work or working on stuff. To keep the shoulders healthy, we have to stretch them backwards, which stretches the pecs, but also work the joint capsule in the posterior or back aspect of the shoulder capsule. So that's what we're doing here. We're just mobilizing it. I suggest 10 to 15 times, and as you work that, you can feel it, and you'll start to get a little lactic acid burn. That's good. It's doing what it should do. Don't get too crazy with it. When you start out, what's nice about the stretchy band is that it'll accommodate with you a little bit. So you can start out, if you can only go to here, keep your arms locked. If you can only go to here, great. Work that motion. As you become more flexible, you can choke in on the band a little bit more, get a little better stretch as it goes over that. I'm Dr. Owens. Use this to help you stretch for the hip that you can do at work while you're sitting. Maybe you're sitting at the computer and need to take a little study break. This will keep some of the pressure off the hips, allow them to be more mobile. Also alleviating the low back pain. When you do this stretch, you just spread the legs apart, lower legs parallel, and you're going to just pulse forward. Keep the lower back nice and straight, and you're just going to pulse in. Pulse in with the stretch. You'll feel the stretch, and then you relax. Pulse in, you'll feel the stretch, and relax. You put slight pressure out on your knees. Do this 12, 15 times. You can do it 3 to 4 times a day if you like. It'd be great for the hip joint capsules and low back.